Hi everyone! In today's presentation, we're going to explore a topic that deeply rooted in our identity as Filipinos, our cultures, values, and beliefs in health and healing. Let me introduce you to the amazing group I'm working with on this presentation. But first, I'm Christina Al Curameng.
Good day everyone, I'm Remely Salaginto.
Kate Ashley Baklig.
I'm Lovely Cheryl Balange.
Influence of culture in health-seeking behavior. Culture plays a powerful role in shaping how individuals and communities respond to illness and seek healing. In the Filipino context, many health-related decisions are influenced not only by medical knowledge but also by deeply rooted traditions, values, and spiritual beliefs. People may delay seeking clinical treatment in favor of home remedies, herbal medicines, or spiritual rituals. Understanding this culture influence help healthcare providers anticipate behavior and communicate more effectively. Influence of culture begins at home.
In every Filipino home, health decisions are often made as a family. Culture plays a central role in when, where, and how care is sought. Some delays going to clinics or hospital, choosing instead to follow familiar, traditional practices. Filipino families prioritize group harmony and often makes decisions together, especially regarding healthcare. Nurses should involve the family in discussions and care planning, recognizing their influence on patient choices, and nurses can leverage this network to provide support and education.
Herbal medicine has been part of Filipino healing for generations. Filipinos commonly use herbal remedies passed down from elders. Plants like lagundi for cough, sambong for kidney health, and tanglad or lemongrass for colds are widely trusted. These reflect a strong belief in nature's healing power, often used before consulting a doctor. These remedies are sometimes used before or alongside modern medicine. Nurses, we must understand and respect these preferences. Instead of rejecting these practices, we can educate patients on how to safely combine them with modern medicine.
Many still turn to albularios or helots believed to treat ailment caused by imbalance, spirits, or bad energy. For many, these healers are more accessible and emotionally comforting than formal clinics. The Filipino family is closely knit. When one member falls ill, the entire family is often involved in deciding how to address it. Traditional healing practices such as consulting an albulario or folk healers or helot, traditional masseur are still practiced, especially in rural areas. Filipinos may utilize traditional remedies or seek guidance from albularios, but nurses should be aware of these practices and approach them with respect, potentially integrating them into the care plan when appropriate. Respecting this tradition builds trust. It opened the door to guiding patients toward complete care without judgment.
Social values, pakikisama, and utang na loob. Pakikisama or keeping harmony and utang na loob or debt of gratitude influence health decision. Some follow advice out of respect even if delays professional treatments. Pakikisama has the connotation of getting along with people in general. The word pakikisama literally translates to helping others. Therefore, these traits usually foster general cooperation and performing good or helpful deeds which can lead to others viewing you in a favorable light. Filipinos value social harmony and may go along with others' health choices even if they personally disagree. This can affect patient compliance or willingness to speak up during health consultation. Utang na loob means to pay your debt with gratitude. With utang na loob, there is usually a system of obligation. Gratitude towards a healer, elder, or community figure can influence choices in healthcare. A patient may continue seeing a traditional healer out of loyalty even when other options are available. Nurses must be sensitive to these values. Building rapport with families help create shared decisions that honor both cultures and science.
Common beliefs of Filipino like usog and nuno sa punso reflect deep-rooted spirituality. Illnesses is sometimes seen as a spiritual punishment or imbalance, not just physical problem. Some illnesses are believed to be caused by supernatural elements like usog or harm caused by someone greeting a baby or child without protection, or nuno sa punso or offending a spirit living in mounds. Some Filipino attribute illnesses to supernatural causes such as spirits or curses. Nurses should be aware of these beliefs and address them sensitively, understanding that they may affect a patient's willingness to seek medical care. Relevance in nursing. Understanding these beliefs prevent conflict and miscommunication. It let us approach care holistically with compassion and cultural insights.
Culturally, competent nurses improve health outcomes. We don't just treat symptoms, we understand backgrounds, beliefs, and traditions. Culturally, competence means being aware of and respecting the beliefs, practices, and needs of people from diverse backgrounds. For nurses working in Filipino communities, it is essential to recognize traditional beliefs and not dismiss them outright, build trust by listening and incorporating culturally acceptable care options, educate patients in a respectful, non-judgmental way, helping them bridge traditional and modern medicine, provide holistic care that respect both scientific and cultural dimension of healing. When we respect when patients come from, they are more open to where we can lead them toward better health.
Culture is not a barrier, it is a bridge. By honoring Filipino values in health and healing, we create care that is inclusive, respectful, and effective. Promoting health in Filipino communities requires more than just medical knowledge. It requires empathy, cultural understanding, and respect. By honoring Filipino cultural values and integrating them into nursing care, we ensure that our approach is not only effective but also compassionate and inclusive. This builds trust and leads to better health outcomes in the long term.
Filipino culture significantly shape health beliefs and healing practices. Filipinos often views illness through a lens of both natural and supernatural causes, with a strong emphasis on family, community, and traditional remedies. Community health nurses need to understand these cultural nuances to provide culturally sensitive and effective care, particularly regarding disease prevention and health promotions. To care for the Filipino is to understand the Filipino, respect, empathy, cultural competence. Thank you.